how's it going? So I'm back with another video for the NICU series, and today we'll be talking about storking. So if you don't know what storking is, it's basically when we go down to L&D and help out with deliveries. So that's one of the cool things about my job. We're not necessarily always stuck in the NICU. Every once in a while we can go down to labor and delivery and help out. This isn't something that we do often. It's mostly just if you want to become Stork certified, or if you're up for a new admission, you kind of just want to go attend the delivery and bring your patient back to the NICU with you. Whenever a woman is about to give birth, we get notifications on our phones, so we have a special little ringtone that goes off, and it will say on the screen delivery, and it'll tell us which room the patient is in. So the Stork team will attend that delivery, and the Stork team is usually the resident, fellow, or attending, and also the charge nurse. And we can also send out another NICU nurse, so if a NICU nurse wants to be Stork certified, or like I said before, if they're up for a new admission, they just want to attend the delivery and bring the patient back, they can go. And high-risk deliveries are the ones that are preterm, so if the gestational age is less than 37 weeks, or if it's like meconium stained fluid, or we just know that the patient has had some type of prenatally known abnormalities or something like that, then we will attend the delivery. And you guys are probably wondering what I mean by saying Stork certified. So once you have been working in the NICU for about 2 years, they expect you to train to become the charge nurse. And in order to do that, you have to be Stork certified. So you have to attend at least 4 deliveries, and they want you to participate. So they want you to actually do some hands-on things, maybe listen to the heart sounds, actually get in there and do something. So once you do that 4 times, you get checked off and you are Stork certified. So let's just do a quick little walkthrough and pretend like a delivery is going off. So you can be on the unit with your patients, and then your phone goes off and it says delivery in OR1. So you know that you need to go to OR1, that's where it is. So you and the charge nurse will grab a Stork bag, and that is full of all of the important items that you may need in the delivery. So it's just like a little bag. So you take that and you take a little monitor with you, and you go to the delivery. So once you get there, you want to make sure you know who is doing what. You don't want to get in there and then 2 people are reaching for the stethoscope to listen to the heart rate. So you want to define the roles. So who's going to be in charge of airway, who's going to be in charge of listening to the heart rate, who's going to be in charge of putting on the pulse ox, the leads, and just monitoring the baby, starting the APGAR and the timer button. So you really want to make sure that you communicate and know who is doing what. Also, when you get there, we want to do what we call the RAM3. It's basically just like a little acronym. So it's RAMMM. The R stands for the reason, so why are you there at the delivery? A stands for age. What is the gestational age of the baby? M is maternal medication, so is a mama mag or any other medications. M can also stand for multiples, so are there twins, triplets, or something like that. And the final M is, what is the final M? Oh my gosh, I'm blanking. Oh, the final M is meconium. So it's the fluid meconium stain. So that's important to know, like, do you need to have your suction ready and stuff like that to prevent aspiration in the baby. Before the baby is delivered, you want to also make sure that you have all of your supplies ready. So stethoscope, pulse ox, leads, literally suction, like just everything you need. You want to make sure that the radiant warmer is already heated up so that you're not putting the baby on a cold surface. So just make sure you have everything ready to go. Once the baby is out, you want to make sure someone presses the start button on the timer, and they're going to bring the baby over to the warmer. So someone's going to go ahead and immediately start listening to the heart rate so that you can know if the baby's heart rate is in the normal range. And once you're listening, you know, you want to tap your fingers so everyone else knows how fast the heart is beating, or get some type of idea before the leads are placed on. Someone else is going to put on the pulse ox, leads, suction if necessary, and just make sure the baby is okay. So this is one of the reasons why it's very important to be NRP certified, because when you go to these deliveries, something can go wrong, so you have to know how to resuscitate a newborn baby just in case. You also want to remember Mr. SOPA, so mask, reposition, suction, open mouth, increased pressure, or alternative airway. So it can be kind of scary, you know, the adrenaline is pumping, but you have to make sure you stay calm and just do everything that you can to make sure the baby is okay. So after a few minutes after the baby is born, you're going to decide whether or not the baby needs to go back to the NICU or if it can stay with the mom. So if it goes back, then obviously you're going to take it to the NICU with you and get the baby settled in the unit. I have personally only been to 2 deliveries so far, and I've only been signed off once, so I still have to attend at least 3 more and participate. It's really exciting, but I still get nervous when it comes to the kind of things, but I am soon approaching my 2-year mark, so it is something that I do have to complete soon. And it can be a little scary, you know, as a new nurse, having to participate and stuff like that, but it's also really interesting, and it's cool to see how things are done in L&D. And of course, things are going to be done differently depending on what hospital you are, and that's just how we do things where I work. So back when I was in nursing school and I did my preceptorship, things were a little bit differently. I don't think the charge nurse necessarily went to all the deliveries. They just had a nurse who was on call, and they would just be on the unit helping out any other nurses that needed help. But whenever there's a delivery, that on-call nurse would go to the delivery and handle everything there before bringing the baby back up to the unit. That is pretty much it for this video. I just wanted to let you guys know that storking is another one of my duties as a NICU nurse. I don't know if a lot of people know that NICU nurses can go down to the L&D and participate, so I think that's a really cool thing to keep in mind if you do want to become a NICU nurse. But I hope you found this video helpful and interesting, and I hope you all have a lovely day. Bye!